Good morning, everybody. Welcome to our webinar today. My name is Kerry Mahoney, and I'll be doing the presentation today. Thank you all for joining us. I just wanted to take a minute or two to make sure you have a good webinar experience. If you're having any issues at all, what I recommend is that you just log off and log back on, and that usually resolves just about everything. You will all be receiving a copy of this presentation after the webinar. And I thought it would be just helpful if we could, if you could just chat in. I have muted you upon entry because we do record our sessions and it makes for a better sound quality. So if you could just practice, make sure you can hear me okay and see the screen, just chat in. And let us know, are you a parent, a caregiver, a professional? And I also want to say welcome to Commissioner Ryder from the Department of Developmental Services. And she's our guest today and will also be sharing a little bit about what's going on with the Department of Developmental Services. So let me see. Okay, we're getting a couple chats in here. Parent and professional, so we've got a mix. All right, a lot of people who wear dual hats, parents and professionals. So I do want to take a moment just to thank the Doug Flutie Jr. Foundation for Autism. They have generously donated and are sponsoring this week's webinar series. So anyways, Jane, I'm going to unmute you and look forward to hearing from you.
Excuse me one sec. I'm having trouble. I'm on my phone. This is Karen Burns. I'm having trouble doing the chat. So I'll just tell you, my name is Karen Burns and I'm a parent.
Okay, thank you, Karen. All right, so Commissioner Ryder.
Good morning. Can everybody hear? Kerry, can you hear me?
Yes, yeah, you're good.
Great. Well, good morning. I want to thank Leo and the ARC for inviting me to participate this morning. And I appreciate everybody taking the time to participate in this WebEx. If I could just share a few things of what's going on with the department. First of all, I want to thank everybody. I mean, this has been an incredible time, and I can't imagine what folks are going through, both people working in agencies supporting individuals with intellectual and developmental disabilities, but families. I was speaking to my staff earlier this morning, and it's such an unbelievable experience what we're all going through, and something that was hard to predict and hard to plan for and hard to react to. And as a department, DDS is doing its best to work with everyone and trying to respond to all the issues coming up. But this is such a unique experience in that, you know, in working with the department, we've all gone through different type of crises that we've had to respond to. But this is so unique in that not only is it affecting our work and what we do to support people, but it's affecting our personal lives and our lives at home. So as we're trying to work again to make sure that people are safe throughout our system in DDS, I know that whether it's our state employees, whether it's agencies and their staff and families, the things you're dealing with are just unbelievable, whether it's taking care of an individual at home, whether it's having people in your life being tested positive, whether it's not being able to visit loved ones in nursing homes and hospitals. It's just incredible, and people are dealing with it 24/7. As folks know, the next 2 weeks are going to be crucial here in Massachusetts as we're predicting the surge of the number of positive cases are going to happen. But we have done our best to continue. We talk to Leo Sarkisian at a minimum of 3 times a week, usually more than that, as he keeps us updated on what's going on in your world. But we're also listening, and we're trying our best to be able to respond to your concerns with the issues that you're bringing up, and what we can do to help that out. Folks know we're a huge agency, we're a huge bureaucracy, we're hugely regulated, but we're doing our best at this time to be as flexible as possible. And I think we've done a lot, especially through our family support centers, in making it much more flexible for families and the individuals we support to be able to meet your needs during this time. And we've done everything as far as increasing some flexible funding allocations to making sure that you have any type of technology, Chromebooks or iPads necessary to communicate, some respite options, and again, anything that we can do to make it possible that people get through this. But I hope as commissioner, I know we're only going to be able to get through if we work together. So again, I appreciate this opportunity to talk to folks through this WebEx, but I encourage you to let me know, let Kerry know, let Leo know if there is anything possible the department can do to help you through this time. We want to work with you to make things happen. So thank you very much.
Well, thank you, Commissioner Ryder. Really appreciate it. I imagine everybody is working around the clock at DDS to try and put as many things into place. And from what I've heard, people are really appreciative of the flexibility that's happening, especially around families. So thank you. So this is a very timely subject that I want to talk about and offer information with you today. And it's about emergency planning. And I just wanted to share some thoughts, some resources, and some online tools that can help with planning. I'm trying, my screen's not moving. Oh, next. Okay, sorry. It's not letting me. There we go. Okay. So this is a photo of Evelyn Hauslein, who has been a lifelong volunteer for the ARC of Massachusetts. She's also a mother of 3 children, and one being her son Tom, who has special needs. I took this photo from a webinar we did a couple of weeks ago with the Massachusetts Sibling Support Network on future planning, and we called it Passing the Baton. So this is Evelyn's way of kind of making sure information on her son is complete. This is her second volume of a notebook, and she has everything there really is to know about her son in that notebook. So she's been working on this for several years. But who should be planning right now? You should be planning for your children, obviously, whether they're children or adults, your spouse, your parents, other people you care for, but also so important to start planning for yourselves. The CDC recommends that everybody creates a household plan of action. And, talking with people who need to be included in the plan ways to care for those who may have greater risk for serious complications. Obviously, very much your loved ones with intellectual developmental disability, but it may be your parents who are frail elders and that sort of thing. I have a 90-year-old neighbor across the street, and we help with groceries so that they don't have to go to the grocery store. But thinking about supplies, equipment, medication, special foods. I mean, this is something you live every day, and I'm sure you're taking care of it. Also, gathering insurance information, important documents, just really important to maybe, if they're in separate files, putting them all in one, a notebook or whatever. Get to know your neighbors. Identify aid organizations in your community. I know in my community, there's several people who are volunteering to run errands for individuals. So I think at this time, people do really want to give back. List and contact names of your service providers, really important. And make a list of all the emergency contacts. And also just making adjustments in your home if somebody becomes ill. How, can you move the bedroom around so that they are not exposing maybe their someone that they're sharing a room with? Do you have more than one bathroom? Can you just have one bathroom be there for the person who is affected? So there are lots of things to think about, and I know everybody is busy trying to take care of themselves, their families, and their loved ones, and also a lot of you are also working. So, but just some things to add to be thinking about. There are a lot of really great online ways to plan as well, and I thought I could go through some of these with you. Again, I'm having a little, here we go. Okay. So there's many online documents, and, some have cropped up because of the COVID-19 virus, but I have vetted all of these different sites and can tell you that they all really have some really great points. So families whose kids have complex medical needs, it's kind of concerning looking at some of this information. I know, there's the top of everyone's worry and anxiety is, what if my child does get sick? What if I can't attend the hospital with them? What about if your spouse gets sick and has to be hospitalized? Is there, what kind of information should be shared? So, I want to, just warn you that some of this information is really alarming and concerning, but it's important. So if you do have kids with complex medical needs, check it out. I also found a COVID-19 planning document, and it's pretty basic, but it kind of goes through all those little checklists. And I think at this time, you may not, you don't always think of everything. So that's just another little template to look at. You'll all be getting a copy of the presentation, so after the webinar is over, so you'll all have the links to all of these resources. Preparing for emergencies. This was done actually years ago by the Shriver. It's a good basic information, and it kind of goes through just more than the COVID-19, but just dealing with disasters and emergency situations. And then there's also a planning tip tool for families who have loved ones with autism from the Autism Society. I don't know if it's really just autism, but a lot of these checklists can be used by just anyone. So I encourage you to check them out just to make sure that you're feeling like you're on top of things in your home. And I'm sure there's many. Actually, I'm part of a learning community, and Michael Small, who is a leader in self-direction and person-centered planning, is in the process of formulating another kind of planning document. So we'll be sharing these, and I'm sure more will be coming. And then the other thing I wanted to talk about is just there are some other really good resources out there. I don't know if any of you are familiar with the letter of intent. It's a recommended document that many financial planners, estate attorneys, agencies, planners, and that sort of thing, they really encourage it. It's not a legal document. It's not part of your will or part of the trust that you might have developed, but it's a great tool to look at all those different areas that everything about. There's so much information on your loved ones, and it's in one document. So the Center for Future Planning at the National ARC, they have an online letter of intent that it's pretty easy to fill out. You saw on the first slide that Evelyn, she has hers actually in writing in a notebook, which is great too. So, but this is just an online tool. A lot of people like to look at maybe their loved one's birthday or other annual anniversaries to keep up with their letter of intent. It's just a wonderful tool to have and for you to pass on when other people need to be involved in your loved one's care. Also, another wonderful online resource is something called 5 Wishes. It's an advanced directive and really how to start that conversation. These decisions are never easy. They're scary. They're anxiety producing, but the fact that you would have a voice for yourselves, a voice for your children. This can be used for adults and children. And so, what are the wishes? A lot of people, even though it's highly recommended, don't have a will. And so, in this day and age, when we're really facing very, very scary times, the preferred method would be to go through an attorney and, do the will and all the required paperwork through there. However, if you haven't done it or you can't afford an attorney, I did speak with a attorney who specializes in people with special needs, and she says that she actually recommends LegalZoom. And you can create online a will, a power of attorney, and you can name guardians for your child or children if they're under the age of 18. I think the documents start at $89 to purchase, and they can go up depending on what kind of package you need and how many you do need. So that's just another really, kind of easy and quick way of, if you haven't done it yet and it's affordable. One of the problems is you will need to print it and you will need to get witnesses to sign it. So that might be a little trickier in this day and age because the witnesses cannot be they couldn't be the people who you were naming guardian or that sort of thing. But also I just wanted to mention that I got some information from folks that more and more attorneys are doing things with virtual signatures, watching you sign through a window. So people are really being very, very creative and trying to come up with ways to get you all through this. And then I just also wanted to mention a couple of other future planning resources. The Center for Future Planning at the ARC. They have lots of different online tools in addition to the letter of intent, decision-making options, housing options, financial planning. So it includes a great electronic planning tools and resources. There's a number of people throughout Massachusetts who actually were trained in future planning back in June by the ARC and the University of Illinois at Chicago, and several of the support brokers through the ARC-MS also have been trained in future planning, as well as other professionals throughout Massachusetts. We trained about 27 people. And then they're also doing online classes, so we're adding to that number in Massachusetts. So just encourage you to check it out if you can. Also, Siblings Forward is Boston University researchers are developing a new program for adults with siblings on the autism spectrum. And it's called Siblings Forward. I was actually on their advisory council. It's a great tool for siblings who want to take a little bit more ownership in starting the future planning ball rolling. So I just wanted to let you know that, our webinar schedule, Mondays at 12 is with Leo. He gives an overview of updates. The check-in with me, if there's any subject you'd like me to cover, I'd be more than happy to do so. Also, Thursdays at 11 is a state update with Government Affairs Director Morris Sullivan. And then Fridays at noon, Ellen Taverna, our policy officer, has been working very closely with the ARC, the National ARC, to really dive into what the federal government is doing, what Congress is doing. And as you know, information just is coming so fast and furious that it's a good thing to do, just to make sure you're all on top of it. One thing we just learned is that we had thought previously what had happened is that caregivers who are caring for adults had to leave their jobs, and that we're not going to be part of that paid leave. Well, that since has been changed. So they're making an exception. So families who have adult loved ones at home will most likely be paid under this family leave. The ARC is though still working feverishly with them because not all caregivers are parents. Some are siblings, some are other relatives, and so it doesn't include them at this point. So again, the ARC is definitely, they've got your back and are examining every word in any kind of bill that's coming through. So most of you, I'm sure, are familiar with the ARC. We are the largest network advocating and supporting people with adults, serving people with intellectual and developmental disabilities, including autism, and their families. And so at this point, I would like to open it up to any questions you may have. And I'd be curious to learn about any future planning, emergency planning tips that you have found very, very helpful. So if you could just chat into me, I'd love to hear from you.
Kerry, can I just talk in?
Oh, sure. Hi, Herb.
Yeah, how you doing? We've been working with a behaviorist that through Joe's DDS funding, we have some behavioral consultation. We also have the folks that caregiver still working with him via telehealth. And we've been actually working on emergency procedures with Joe kind of in the house, fire drills and what happens if glass breaks on the floor, and a whole bunch of other things that our behaviorist is thinking about and taking ideas from us too. So he's been working on it every day, getting some drills, and so it's been it's just a different focus for a different time, but it's really coming in handy.
Great, thanks for sharing. Okay, we do have a question from Beth for the commissioner. Are there ways that all these citizen mask-making efforts can be connected to the group homes and other agencies in need of PPEs? So, oh, there we go. Sorry, Jane. Let me unmute you.
How's that?
Yeah, we can hear you. Thank you.
Okay, perfect. Beth, thank you very much for the question. As folks know, there is a huge challenge as far as getting PPE across the state, not just with DDS individuals and their supporters, but of course in our whole healthcare system. We are working very, very hard in trying to find ways of obtaining masks, thermometers, so forth. So we're able to protect the staff and individuals in our group homes. Right now, with limited resources, we're really focusing on our efforts on those places where right now people have tested positive. So if there has been a group home where a staff has tested positive, of course, they're sent home and told to quarantine. Individuals living in our group homes, if they test positive, they're quarantined, again, if they don't need hospital care. And we're focusing our PPE to get to that home. So the staff can continue to work and interact with all the individuals in the home. And doing our best, again, to keep the other residents in that home safe and protected as we get through this crisis. I hope I answered your question, Beth.
Okay, thank you. So Herb, Leah's asked if you could repeat who funds the behaviorist for Joe.
It actually comes through DDS. There's a line item for behavioral health consultation, and we use him for maybe an hour a week based on kind of the programming that we would like for Joe. And then the caregiver, a daily caregiver,
having my prescriptions delivered.
DDS budget as well. And then
All right.
social stories, and then the caregiver reviews the social stories and works with Joe, and then reports back to us kind of on how it went that particular day. So it's all still within Joe's DDS benefit, but it's very really structured.
Okay, thank you. All righty. And actually, Jane, Beth had a follow-up question about how DDS is deciding who to test. So I'll mute you. There you go.
Thank you. Right now, Beth, the people being tested are people who show the symptoms. So if an individual in one of our group homes has a high temperature, or, and I mean, that's the big warning sign right there, or is showing any other COVID symptoms, their primary care physician is contacted, their primary care physician has to do a doctor's order, and then they're tested. Unfortunately, right now, that's the criteria. And that's the same for the general public, from what I understand. So I'm hearing from a lot of families, they don't understand why we just can't test everybody. Right now, we just don't have the capabilities of doing that, but we're working with individuals and their primary care physicians, and we're being very vigilant as far as making sure if anybody shows any type of symptoms or warning signs, we make sure that they're getting tested.
Okay, thank you, Commissioner Ryder.
I have a question for Commissioner Ryder as well. It's Lucy Chansky, and I can't seem to figure out how to chat, so I need to talk.
Okay.
Hi, Jane.
First of all, Lucy, how are you?
I'm well, thank you, and I hope you are too.
I am, thank you.
I guess it seems to me that it would be wiser and probably difficult, but really important to take precautions before people get sick. And if people had masks, if the staff had masks, I don't think most clients will wear the mask, but if the staff would wear masks, it might prevent any possibility of their bringing in the virus. So I'm wondering, what can we as individuals do to try and get masks for our programs?
It's tough, Lucy. It's very tough. The supply, we're hearing that, we're working with the Executive Office of Health and Human Services, the command center that's been set up by the governor. We're getting some access to masks through that source. Last Friday, they were able to deliver 8,000 masks that we were able to get out to our regions. But as you said, it's not enough, but we're continuing to try any method that we can. I heard some great news last week. You folks know we have a number of assisted technology centers across the state. They're at Hogan, they're at Clark Street in Worcester, we have one out in Northampton. We found out there's actually a piece of equipment in Worcester at the Clark Street Center where there's a machine that they use to clean wheelchairs, but the wonderful people at that center have discovered they could actually use that to clean masks. So, so we're getting masks out to our group homes. You're absolutely right. It's the best way to prevent things, but we've also found ways that we can clean masks and reuse them, which I think is also going to be a huge benefit as we're waiting to get more masks throughout our system. But Lucy, that's a great point. I mean, we should all be wearing masks, to tell you the truth. And we're trying to, again, pinpoint the houses where there's already cases to get the very best masks too. But, people are making their own masks on their own. And, we're encouraging staff to wear them and to take every precaution. But we're continuing to try any method at all that we can get more masks into our system.
Is there anything though that we would talking to legislators help? I mean, what is it that we could do to make more people aware of the issue and the need?
You know, I don't know, because it's out there. I think the need, you know, it's awful. We're of course fighting for DDS and fighting for the people we support and our staff. But I watch the news every night, and it's really discouraging when you think even hospitals throughout Massachusetts don't have enough protective equipment possible. So, I mean, it never can hurt to keep in communication with your legislators, but I know the governor and Secretary Sudders, who is in charge of the command center, is using every means possible to try to get more masks. A number of our providers are trying different type of sources. That's why I said I think next week we're expecting a huge shipment to come into the state that we'll be able to access. But you know, if you folks are more creative than I am, if you think of any method or way of accessing protective equipment, I would encourage you to do it.
Okay, thank you.
Thank you.
Yeah, you know, I mean, I think you have a great point, Commissioner Ryder, about that everybody should be wearing masks. I know I don't sew, but I can make a mask in 30 seconds with a bandana. So I saw something the other day too, that people are making them out of socks. So if you just Google YouTube, you would be able to find your how to make a mask fairly easy. I know they're not the hospital masks, but you know, again, I think it's everybody needs to use precaution. Right. And so, you know, the other thing is Crystal, you talked about, do you mind sharing the ways you found that are successful at cleaning masks? I know for the cloth masks, people, you know, you just throw them in your washing machine, you know, at the end of wearing them, and that, you know, is able to typically take care of information or the virus. I'm sorry. So I'm looking at another question. Okay, from Christine. And I think this is also this is for everyone actually. She understands that the rapid test for COVID-19 is less intrusive, and that folks in her son's group home have had difficulty getting conclusive results from non-rapid tests due to their resistance to swab procedures. Anybody have any updates on that?
And Christine, that's I have not heard about the rapid test. So let me do a little research on that. That's interesting, that the non-rapid tests people are having trouble with. Do you know specifics about the rapid test, what that actually looks like?
My understanding, this is Kerry, is that it doesn't have to penetrate deeply in the nose.
Okay.
Is that accurate? I know, Christine, I think you have far better information. Even if you want to unmute yourself and just share what you know.
In the wrong place. I'm sorry. Yeah, I'm not a very fast typist. I mean, I understand that it's the test that involves the machines that Abbott has produced, and that it does involve a swab that doesn't go as far up in the nose. And I guess there's a drive-through testing center now at Gillette for first responders, and I just saw this morning that another one with the Abbott test has opened in Lowell, and I was just we've had this situation in my son's house where, because of the resistance of and these are individuals with autism who are very sensory defensive, and so we've had these tests that that we've waited several days and the result comes back inconclusive because it's just this, trying to get the swab is really hard.
Right.
So
Right.
just in terms of this population, as we go forward, it seems that as those become available, that would be a great thing to be available to this, particularly since they're living in a congregate setting. So
Great. Thank you, Chris, very much.
Yeah, thank you. That was that's good information. Okay, how about anybody else with anybody in terms of the emergency planning? Have you done what have you done in your home? What have been the successes that you've had? Anybody? Wait a minute or so. All right, well, looking at the time, I'm sure you all have a busy schedule ahead of you. I wanted to thank everyone for coming today and being part of the call. And also, of course, Commissioner Ryder, thank you so much for making this time out of your schedule today and joining us. And, we're all going to work together and get through this. And I'm hoping we'll have good celebration at the end. So thanks, everyone.
Thank you, Kerry, and I want to thank everybody on the call. And please, please stay healthy and stay safe. Thank you all very much.
Okay, everybody take care. Have a great day.